I will tell you, every single person is like, it would never be me, right? We had done fundraisers for our friends. We had a couple of instructors that went through breast cancer. We lost a wonderful friend. Then one of my instructors at my studio was diagnosed with stage 1. 6 months later, my other instructor's husband was diagnosed with stage 4 glioblastoma. We lost him. When I was visiting him in hospice, I was limping, and it was about 2 weeks later that I received my diagnosis of leukemia. At 48 years old, which I consider prime, I was a very young 48, so that was shocking.
That is young. Hi, I'm Dr. Agolli. Welcome to Rethink My Health, sponsored by Progressive Medical Center. Each week, we're going to be having a radio show talking about innovative topics that really matter most to you and your family and your friends, inspiring you to take action to get your health to the next level. Rethink My Health by Progressive Medical Center. Welcome to Rethink My Health Radio Show. I'm Dr. Agolli, going to be your host here for the next 12 months, actually. We actually are going to be on the air for 12 months on multiple stations. So if you're hearing me for the first time, I want you to stay tuned because we got some very innovative, exciting, and interesting topics as we're going to delve deep into the mysteries of certain chronic diseases and chronic conditions. And chronic disease is an all-time high right now in the United States. We are seeing heart disease on the rise, cancers on the rise, autoimmune disease on the rise, neurological disease on the rise, and we're going to really find out root cause. This show is about education. It's about wellness. It's about empowerment. It's actually galvanizing you to take action. And integrative medicine is just good medicine. I've been in Atlanta for the past 27 and a half years, and my passion has been about education, wellness, thinking outside of the box. As a matter of fact, there is no box in our radio show. We are all over the place. We're looking for innovative treatments. We're looking for innovative diagnostics. We're finding out cutting-edge root cause. So if you stumbled on, keep listening because we're going to have some exciting guests on our show. And a little later, we're going to be talking about one of the dreaded diagnoses, the big C. That's right, cancer. Unfortunately, cancer, all-time high right now. According to the CDC, NIH, well over 2 million Americans are going to be diagnosed with cancer this year. We're going to talk about a journey shortly with a patient that did some conventional therapies, did integrative, and we're going to get her perspective, and also she's also in the healthcare space as well. So that's going to be very exciting to hear her journey so you can be inspired as well. But I want to talk about a couple different things first. What is integrative medicine? Integrative medicine is a term that's not been around in our country for maybe a decade, maybe 2 decades. And that's really looking at a combination of both traditional healthcare and also natural complementary. It used to be called alternative, it is some aspects of holistic, but integrative medicine is really a partnership. And that's a partnership between you, the patient, if you're the patient, and the practitioner. It's a team approach. When you're ill, a lot of times there's a lot of confusion. What do I do? Is this research-based? Do I have to take this medication for the rest of my life? So I want to be very, very clear. Integrative medicine actually is not against traditional allopathic medicine. It's a combination looking at the best aspects of that form of medicine. Could be medication, could be surgical intervention, it could be all kinds of different therapies that require a skilled, traditionally trained allopathic doctor. An integrative specialist actually takes a look at what's scientifically based and will put you in a position to allow that body to heal. This is how God designed our body. It's called homeostasis. When everything's in balance, then the body begins to heal. That's what our philosophy is all about. And we focus on whole person, physical, emotional, spiritual, environmental. And that's what's missing in our country today. Americans are looking for the quick fix. I hate to say it, guys, there's no such thing as a quick fix, right? Now, there's certain surgical interventions that will help you, but you have to find out what's going on, take a step back, and really plan out a plan of attack to have a good quality of life. And that's why we're so excited, Rethink My Health, which is sponsored by Progressive Medical Center. Progressive Medical Center is one of the leaders in functional integrative medicine for over 27 years, treated well over 45,000 patients, and that's a whole team of medical doctors, nurse practitioners, naturopathic doctors, registered dietitians, chiropractors, health coaches, advocates really working together cohesively to help you navigate this maze of what we call healthcare. Yes, I love this country. It's one of the greatest countries in the world, and we have so many advancement technology, but guess what? We are failing in our healthcare system. Over 19% of our GDP is spent every single year on healthcare. Yet we're ranked one of the lowest in the world. Industrial nations. According to CIA.gov, they do research on this. The United States is like ranked close to 40th in longevity. Why is that when we're spending more than any other country? And I believe it's because we are not looking at the principles of root cause. And we're looking for a Band-Aid just to mask over everything. So that's what this show is going to be about. I'm excited about this. My background is in integrative medicine. I've been doing this for well over 30 plus years. And I look at the human body totally different at times. And I know that when you put everything back in balance, you can heal itself. So we are really excited about Rethink My Health. And our goal is for you to think about that. But I want to really get into the partnership for just a second here. When I use the word partnership, that means that you, the patient, have to have some skin in the game. You have to take that first step. Unfortunately, we have allowed insurance companies, and insurance companies are needed, of course, because the concept of insurance defrays that cost, right, for a catastrophic event. The problem is that a lot of Americans are only relying on their insurance, and now over the past decade, we have seen deductibles all-time high, co-payments all-time high. A lot of patients come in saying, why do you even have insurance? My deductible's $5,000, $7,000. My co-payment is 30, 40%. It's almost to the point where, I tell a lot of patients, you have to make a decision on how much you're going to invest on your resource. Yeah, you heard me right. This is an investment. Your health is an investment. And that's what our goal is with Rethink My Health. We are going to be on this journey together over the next 52 weeks. So if you're hearing me for the first time and you've never heard about integrative medicine, just stay tuned for more education. But my goal today is to pique your interest and to galvanize you to take action, because this is an investment in your health. There's nothing more important than investing in your health. So that's why integrative medicine, from my perspective, is one of the best areas to invest in. That doesn't mean you have to abandon your primary care doctor. Primary care doctors do a fantastic job. They don't have the time to spend 45 minutes to an hour with you. A good, functionally trained integrative practitioner will spend that time with you. They will find out about your sleep habits, your dietary habits, your workout habits, your spiritual habits, your stress level habits. These are all very, very, very important when we're putting together a comprehensive plan to help you navigate through this maze. And that's what I mean by a partnership, is that you also have to be part of that as well. And at Progressive Medical, I've trained well over hundreds of practitioners, and a lot of them, well-trained, well-meaning, went through residency, and either one of their family members got sick or they got sick. And they tried just doing traditional medicine. They tried using the medications, they did the research and other therapies that they were trained in, and a lot of them just fell short. They didn't have quality of life, they didn't have the vitality, so they started researching. And some of the best practitioners that practice functional integrative medicine were either sick themselves, as I said, or a family member was ill. And now they see the benefits of doing both. And that's what's exciting about this career field, is that it's growing rapidly. You'll see more and more practitioners that are actually researching and educating themselves. And because they're frustrated as well. As I mentioned earlier, we have the all-time highest of chronic diseases. I mentioned cancer. Well over 2.1 million Americans are going to be diagnosed this year. Heart disease is actually the #1 killer in our country, and cancer is #2. I'm not here to scare you. These are statistics. I like to talk about statistics because guess what? Statistics are reality and they're factual, and they help guide us on what direction we can go, because an ounce of prevention is worth a pound of cure. You have to talk about wellness and prevention for you and your family, and you have to somehow budget that investment of time and resources. So that's why integrative medicine makes a major impact in that. And as I mentioned, the partnership, I want to give you examples of some of the diagnoses and treatments that integrative practitioners can be used alongside. Chronic pain. When we talk about pain, nobody wants to be in pain. I know that when I Used to play a lot of sports when I was younger, and you can go out there and play basketball for several hours or tennis or whatever the case is. As you get older, of course, the body gets a little more inflamed. So I want to talk about that word pain, okay? A lot of pain is due to something called inflammation. So the body is on fire. About 15 to 20 years ago, Life magazine actually did an article, and it had a picture about chronic inflammation, and you saw a forest fire that was low burning. So basically, I want all of you to visualize that low burning fire. And that's really one of the gateways to chronic diseases is inflammation. So integrative practitioners really focus on what's causing inflammation. Why is the body inflamed? Is there a structural anomaly? Okay. And this is where we're big believers in chiropractic or osteopathic medicine, because you can gently bring the body back into balance by these structural assessments and realignment through manipulation or osteopathic manipulation. But chronic inflammation is a problem. Then we go on to, I call this the 4 I's of chronic disease. Inflammation is number 1. Number 2 is infection. Infections could be an all-time high. So what integrative doctors do, they look for infections. And we do that through testing, whether it's blood testing, saliva testing, stool testing. And because we're big believers in the microbiome. So I talked about cancer. So when somebody has cancer, that's a dreaded diagnosis. And a lot of oncologists are very highly trained. They're well-meaning. They've got these phenomenal protocols. If they've been in residency for 3, 4, 5, 7 years, some of them, they've got some great tools, but everything's a protocol. So if you go to your oncologist and ask him, hey, what caused my cancer? A lot of them are just so busy on protocol driven because they believe I've got to get your treatment right away. They didn't take a step back. And a lot of times they're going to say, well, and I've had this happen before, patients come in and they say, well, the oncologist told me that I just got bad luck or it's my genes. So I want to stop there for a second. As trained in integrative medicine, we're very curious, okay? We may not find the answers, but we're curious. So we ask ourselves, we take a step back. Why did the body allow this to happen? Is it genetics? Well, the research now shows that cancer actually is 10% genetic. There is a genetic component. There's no doubt about it. But it's about 10%. But what they fail to tell you is that it's the expression of that gene. It's the epigenetic. What does that mean? Environment, all-time high, okay? All-time high. Chemical toxicity, something called endocrine disruptors. We're all-time high in our country right now. 3.1 billion pounds of chemicals were emitted into our water, into our land, into our air. Where does that go? It goes into the human body because the human body is a sponge. And that sponge holds onto these chemicals, holds onto this toxicity. And God designed the body in such a unique way that you can get rid of the toxicity, but sometimes we have such overload. These endocrine disruptors affect our hormones. They affect our ability to absorb nutrients, and minerals are so important. So that's why we take a step back and we say, okay, was this an infection? Was this an environmental chemical? So it's really important. So a good trained integrative practitioner is going to do a lot of testing. Now why? Because if you don't test, you just guess. And that's why this is called precision medicine, and that your practitioner will be able to navigate this maze. So I gave the example of cancer, and there's many, many other examples that I don't want you out there to say, oh, I'll just wait till I get cancer to try integrative medicine. Hopefully, I can inspire you to take action before that, because cancer is definitely on the rise, and our scientists are constantly looking for new discoveries, but there are some core principles, and this is what we talk about in functional integrative medicine. And that's what I'm excited about, because each week when you listen to Rethink My Health, and we call this show Rethink My Health because we want to inspire you to take a step back and say, hey, what's going on with my health? Everybody has different challenges in life. You have all kinds of priorities. You got your family, your marriage if you're married, your profession, your children, your grandchildren. But sometimes you have to pause and take care of your health. I love that example where they talk about where you're flying in an airplane and the very first thing they say, what happens if the plane's altitude goes down and the pilot brings down the mask, do you put the mask on to the person next to you or do you put the mask on for yourself? It's almost the same thing with healthcare. That some of them out there that's a caregiver, sometimes your health is more at risk than the person you're caring for. So there's definitely a balance there. And that's why we believe here at Rethink My Health that integrative medicine is the solution for optimal wellness and health if you take action. There's no panacea, there's no quick fix. And that's why it's worth exploring the benefits of integrative medicine. So that's where we look at this partnership. We look at the 4 I's of medicine. I gave you 2. I gave you infection. I gave you inflammation. And there's many tests that can look for both of those. Okay. The other 2 I's we're going to focus on a little bit. And then we're going to, after the break, we're going to be interviewing a special guest who not only took on cancer head on, but she navigated a plan of action using traditional medicine and integrative functional medicine. And she came on the other side. Okay, so there is hope when you have that disease. But getting back into the 4 I's. So infection, inflammation. Number 3 is insulin resistance. We're going to talk about that in a second because that's a hormone. Insulin is a very, very important hormone. Without proper insulin regulation, you don't make cellular energy. So everybody talks about glucose is such a bad thing. Well, let me just assure you of one thing. Without glucose, our brain doesn't function. We don't survive, right? It's too much glucose. It's glucose outside the cell. Obesity, all-time high. We have seen a rapid increase in obesity. I actually call it diabesity. I actually call it inflammobesity because inflammation that's not contained will lead to adipose tissue. That's just a nice way of saying fat tissue, okay? But it's the insulin that regulates that glucose. And I remember one of my medical professors talked about this, Dr. Fori, and he was talking about when you talk to a patient that has elevated glucose, which becomes type 2 diabetes, okay? Not type 1, that's totally different for a second. That you have glucose outside the cell. And that when glucose is out of the cell, the body becomes sluggish. So he told us to give this example. If you tell your patient to take their shoes off, and I want them to visualize that they're walking on a wooden floor with orange juice, and I want them to visualize, what does that feel like when you're walking on orange juice on a wooden floor? Sticky proteins. So when you have elevated glucose, it's a big problem. When your primary care doctor says that your hemoglobin A1C is 6 or 7 or 8, or God forbid it's over 10, that's a problem, right? That means you've got sticky proteins. It's affecting your kidney, it's affecting your cardiovascular system, it's affecting your eyesight, it's affecting the body's cells to communicate. Do you know that you have over 30 trillion cells in the body? Yeah, that's a lot of cells. And these cells work together cohesively to communicate how the body operates. The body's an amazing, amazing machine. I always wonder how as humans we've even survived, right? But our body's resilient. Our body can recover. You can have a lifetime of horrible habits. You could be smoking, drinking, all kinds of terrible things and eating bad food. But if you make that commitment to turn your body around, your body can heal itself from the inside out. That's how our Maker made us. So that's why I, number 3, insulin. You got to test for it. You got to find out. And it doesn't matter if you have a little bit. That little bit can become a lot more. And that makes the body sluggish. I want you to visualize that sticky feeling, sticky proteins. I remember having a conversation with a board certified physician, Dr. Melanie Cooper, and she was in charge of a hyperbaric oxygen unit. And she was putting patients in a hyperbaric oxygen unit after they had an amputation. And most of the time it was an amputation of their toe, their foot, their leg, and a lot of it was for uncontrolled diabetes. And she was telling me how sad it was where patients would come in and said, Dr. Cooper, I can't believe that someone didn't tell me that uncontrolled glucose could lead to this. And she was inspired by that. So she really had a quest. She started a nonprofit organization and she basically talked to patients the seriousness. Hey, listen, I'm not here to scare you, but if you have a family member or you yourself are dealing with type 2 diabetes, take action. Take the medication that your doctor prescribed, but do other things as well. There's so many different nutrients out there. There's so many minerals out there, and integrative medicine is one of the solutions. Okay, I, number 4, before we get to the break, your immune system. God gave you 2 immune systems. Did you guys know that? You have 2 immune systems. You have cellular immune system, which is inside the cell, and humoral, outside the cell, which has a memory. Your immune system will protect you. It's a free radical scavenger, and the more robust your immune system is, it's going to protect you from these serious diseases such as cancer or some of these infections that we see out there. So take heed of your immune system. Hey, this is Dr. Agolli here. Rethink My Health. I am so excited on this journey for the next 12 months coming to you from our studios in Atlanta, Georgia. We're educating you, we're empowering you. Stay tuned after this break. We've got a special guest, Christen Perrella, where she took on cancer head on, inspired her to get into the wellness profession, and she's working at Progressive Medical Center as our patient advocate. I'm so excited for Christen. Christen, say hello.
Hello.
I'm so excited for you. And when we get back after this break, we're going to be interviewing Christen, and she's going to tell you a little bit about her personal journey. She was excited to come on here and share, because part of it is that, when you're ill and you're fighting for your life, part of it's giving back as well, too. Because remember I talked about wellness, it's we, it's a concept. Illness is I, it's you, it's individualized. Wellness is us together. We can fight these chronic diseases together and learn from each other. We're constantly learning. And that's so exciting. And that's why at Rethink My Health, we are looking for root cause. We are looking for solutions. We are open-minded to take a step back and say, oh, we should be talking about this medication, or we should be talking about this supplement. Just because it's natural doesn't mean it's the greatest thing ever. It has to be scientifically based, and it has to make sense, and first do no harm. This is what Hippocrates, the father of medicine, talked about, and this is what we as doctors, and doctor in Latin is docere, and it means teacher. So for any teacher out there, believe it or not, a doctor is supposed to be a teacher. That's right, according to the Latin docere. And we're here to teach you, to impart knowledge, and to hopefully have you galvanized to take action to focus on your health. Because I can assure you, if you don't focus on your health, eventually it's going to be poor and low quality of life, and we don't want that, right? We want to have a good quality of life, and that's why we believe integrative medicine is the answer. So coming after break, we're going to talk more about cancer. We're going to talk about some of the advancements with integrative oncology. We're going to talk more about the 4 I's, and we're going to be interviewing Christen as well. So stay tuned with us. We'll be back in a moment. This is Rethink My Health. Welcome back. Rethink My Health. What an exciting segment. Educating you. I hope you're still listening as you're either driving, enjoying yourself time at home with your family. This show is really about education, empowering you. So I want to jump right into my guest in the studio. I want to talk a little bit about what it's like to have a diagnosis such as cancer or autoimmunity. So I want to welcome Christen Perrella. She's our patient advocate at Progressive Medical. For those of you listening, Progressive Medical has been around for 27 years. It's a sponsor of our show. We want to thank Progressive Medical Center for sponsoring this show, making Rethink My Health possible. Christen, let's talk a little bit about your journey. I want to thank you, first of all, for joining me in the studio. I know you're busy. Let's talk about you for a second. I appreciate you being transparent, and I know talking about a personal thing such as battling diseases. Let's go back even before cancer. Okay, let's kind of go back that you're sharing with me a little bit. Talk a little bit about your journey with your health and how you even got involved in integrative medicine.
So thanks for having me, first of all, Dr. Agolli. Obviously very passionate about this topic. So as a kid, I always sort of had a lot of allergies, a little bit sickly. So that was one thing kind of growing up that was frustrating. It was very academic at the time. But as I started to grow up, I fell in love with sports, fell in love with being physically active, especially as I went on to with honors to Georgia Tech as an engineering student. So I did every sport I could get my hands on, and I started getting frustrated because during the allergy season, I would get sinus infections, I would get sick, and it would take me away from my favorite activities. And then I found myself over time on just rounds of antibiotic. I would go to the clinic, oh, you have an infection, here's your antibiotic. So fast forward, I continued kind of separate area of my health, also had really, really bad cycles. But I took care of that with a different doctor, my women's health, and I'd never connected the two. Fast forward to my second child, and I really hit a wall in a health crisis. I had crippling joint pain, exhaustion, and I was referred to a rheumatologist, given a diagnosis of an incurable autoimmune disease I'd never heard of, which is a mixture of lupus and rheumatoid arthritis. So at the time they called it mixed connective tissue disease, also known as overlap syndrome. They said there's no cure, and I was diagnosed I was given a prescription of opiates.
Let's pause there for a second. So if that sounds typical for you or a loved one that what Christen was describing. It is the norm in our country right now, unfortunately. And we're going to dive in a little bit about gut health for a second. And the prescription that was given to Christen, well-meaning doctor, of course, because no doctor wants to see anybody in pain, right? However, did it solve the problem, Christen?
At the time, fortunately, I refused to go on the medication.
Okay, so you were smart enough at that particular time not to do it. Although the pain was real, right?
It was very real.
Yeah.
It was.
And no one really took the time to get to the root cause, which is really a gut issue. And it's interesting because a lot of our internists and allergists out there, they're going to be checking for, especially Atlanta. For those that are living in Atlanta, it is the capital of allergy, of course, and a lot has to do with our environment. And we're big believers in immunotherapy, there's no doubt about it. But they're really missing the gut health aspect of it. So go ahead and continue then, and we'll talk a little more about gut health. But it seems to me that that was part of your journey. So let's fast forward now with your first exposure to integrative medicine.
Well, at that time, fortunately, I heard the radio advertisements on the fish for Progressive Medical. And a friend had gone as well. That is the very first time that I connected gut health to the autoimmune condition. And it didn't make sense at the time because, of course, none of my traditional doctors made any connection to diet, and the gut. So I'm like, I don't understand. I didn't really have any gut symptoms. I didn't have the typical GI distress. But I trusted because I was very sick and I was willing to do the work to try to get some results. A year and a half later, after going through the Progressive program, I really had relief earlier than that, but by a year and a half later, I was teaching kickboxing. So
that's fantastic. You're kickboxing?
That was my very first.
I don't want to get kicked by you, so no kicking today, please, okay? Let's leave it right there. But yeah, you're kicking, that's great. And it's interesting you talk about that because, once again, a lot of well-meaning physicians, they're just going to do some testing. They do something called IgE, which is kind of immediate. At Progressive Medical, Dr. Victor Bouquet, who kind of spearheaded gut health. I remember Dr. Bouquet came back, this is like 27 years ago, came into my office and said, oh my gosh, you got to go to this seminar, Jeffrey Bland, he's the father of functional medicine. I didn't even know what that was back then, right? And because we call it complementary, right? Anyway, he comes in, he goes, everything's about the gut. And I'm like, I was looking at him and saying, well, okay, I trust Dr. Bouquet, but he was 100% right. Gut health is really geared towards optimal health because a delayed sensitivity, meaning that if you had a healthy food today, could be an apple, orange, doesn't matter what it is, and then 2 to 3 days later, it causes inflammation. So that was a lot of your symptoms was really gut health because there are common denominators with multiple autoimmune. Autoimmune, to educate our listeners, is your immune system is attacking your body. It could be your joints, it could be an organ, it could be your skin, it could be all kinds of things. Your immune system is on overdrive. Remember I said at the beginning segment, one of the 4 I's was immune. You have 2 immune systems. One is the cell and one is outside the cell. It's the cell that has the memory. So that's kind of what's attacking. And that's why we really focus on gut health, Christen, as one of the foundational principles of integrative medicine. So
I definitely became a believer. That year and a half later, I was gluten-free before it was cool. That was back in 2009. Completely overhauled my diet and completely transformed back to the athlete I really always wanted to be. And then so I actually walked away from a full scholarship for an MBA in pharmaceutical management. I was one of 9 picked in the whole country. And
so it affected your life that much?
It did.
Where you had to do a different career path?
I changed to career paths and fell in love sort of with fitness. Because of the autoimmune background, I found myself getting into rehabilitative work. So I did, I opened my own Pilates studio. Always, even after my time at Progressive though, I had friends that were nutritionists, chiropractors, and naturopaths. So I kept, in track with that, but I kind of found I was still patching my health together in different areas over the years. The big place that got worse was the cycles. It ran in my family, hysterectomies, and then the, Women's Health Solution, take Advil and get on the pill. And I have 3 daughters. So even 18 years later, for my youngest daughter, they had the same solution. So I'd sort of patched with bioidentical, hormone replacement here, but I was missing a lot. But here I was, a busy mom of 3, entrepreneur, and I was trying to outrun and outmuscle that problem, shall we say.
And that's really good. So now you tried to outmuscle, outrun that problem. So let's fast forward now, because we haven't really talked a little bit about stressors in the body. We're not even talking about emotional stress or anxiety. We're talking about physiological, environmental stressors, right? So definitely stress makes a big deal on the health from a chronic disease perspective, but it's how the body manages it. We'll talk a little bit about that because we're big believers in adapting, especially with talking to cortisol. But I want to fast forward now, the rest of the show. I want to focus on cancer because we are seeing cancer all-time high. You're seeing report after report after report. We're seeing super cancers, young people now in their 20s and 30s. We're kind of shaking our head. How is this possible? How are they getting this super cancer? They're fine, and one day they got stage 4 and it's metastasized. And it's really sad. And unfortunately, in the United States, we declared war on cancer in the 70s. President Nixon declared war on cancer, allocated, I think it was like $500 million. Never a president of the United States actually declared war on cancer. Yet now, 50 plus years later, at that time it was 1 in 7 Americans that got cancer. Today it's 1 in 3 men and 1 in 3 women and 1 in 2 men will get cancer in their lifetime. Not here to scare anybody. These statistics are real. So Christen, let's fast forward your cancer diagnosis. Walk us through that. What happened? What did you do? And where are you today?
So I was surrounded by those statistics before my diagnosis, but I will tell you, every single person is like, I can't, it would never be me, right? So we had a bunch of my group of Rehab Pilates World Yoga. We had done fundraisers for our friends. We had a couple of instructors that went through breast cancer. We lost a wonderful friend to breast cancer. Then one of my instructors at my studio was diagnosed with stage 1. 6 months later, my other instructor's husband was diagnosed with stage 4 glioblastoma. We lost him. When I was visiting him in hospice, I was limping, and it was about 2 weeks later that I received my diagnosis of leukemia, a rare form of leukemia, chronic myeloid. At 48 years old, which I consider prime, I was a very young 48, so that was shocking.
That is young, absolutely. Yeah. Well, I'm sorry to hear about that, and certainly it can happen to any one of us. Doesn't matter. And here's what's interesting. Did you hear what Christen said? Pilates instructor, exercise enthusiast, all of these individuals, you would think, you hear this quite a bit, I'm healthy, I'm working out, I'm having the best diet, I'm doing this, and yet they have cancer. Let me assure all of you listening, cancer can come to any one of us. It doesn't matter how healthy you are. And that's why early detection saves lives. Taking action saves lives. Going to your doctor for these tests is very, very important. And I know a lot of you out there, and I know you're out there because it's me as well. We're in denial. Okay, especially men. Men, I want to speak directly to you. You are in denial. Women drive healthcare, and that's why I love that we work with women, because women really move the needle. And men are catching up, though. That's a good thing. Do not delay. Go to your primary care doctor. Think outside the box. As a matter of fact, Christen, since we're talking about this, I remember about a month ago, one of our nurse practitioners, Magda, came in, and she sees a lot of the integrative oncology with Dr. Paquette and some other team members. And this particular patient, just retired, everything's going great, healthy as can be, decided to do this full body scan, and wham, she was healthy, no problem. Lung cancer. Never smoked at all. It could happen to anybody. So it was early detection. Now she's on a great path of integrative oncology, working on immune system. Okay, so now you were diagnosed. Walk us through your next steps on what you did, and how did you, and when and how did you incorporate integrative medicine?
I will say the diagnosis process had a dramatic event of passing out in the hospital lobby after 3 visits to the emergency room, unfortunately. And we arrived at the diagnosis through an emergency bone marrow biopsy. So that diagnosis of cancer in the first place, in traditional medicine, I'm hearing stories of people just missing it even when it's already there, right? Because I had had such amazing results back in 2009 with Progressive, it's the only place I trusted. And I had a wide range and network of health coaches and nutritionists, but I knew I needed both. I needed MDs. I needed cancer specialists who understood the medication and the therapies and that could work with my oncologist. So I was kind of blown away when I revisited Progressive because, as their name suggests, they had added so many more exciting therapies since I'd been there in 2009. I really was so impressed by the team and how they had grown that as soon as we got the leukemia undetectable in record time too, by the way. So with the chronic leukemia can last up to 20 years in some patients.
Praise God, that's fantastic. And I know your circulating tumor cells, your Signatera test is good, right?
I am completely undetectable.
That's fantastic.
To this day.
Well, let's talk about that for a second, because you did see a traditional oncologist, Dr. Reddy, who's very good, by the way, and he's open to some of these adjunctive therapies. I want to use adjunctive, right? So you could be doing traditional therapies, and unfortunately, there's a lot of physicians that said you should not do anything except this. And here's the reality. The reality is the body's not designed that way, right? The body needs to recover, the body needs to rest, and the body needs to become resilient. It's called resiliency. The more resilient you are, and there's so many strategies, whether that's intermittent fasting, certain nutrients, certain minerals, oxygen, ozone, lasers, photodynamic. And if I'm speaking Greek to you, just keep listening, because this is exciting, cutting edge medicine. It's not only for cancer, it's for many other things. But Christen, walk me through some of the therapies you received at Progressive, because I know that you went through a whole slew of therapies, a whole slew of testing. Just give us a couple ideas for our listeners out there, kind of the next steps working with your traditional oncologist.
It was exciting just to already have, I kept my original binder. So I had this great before and after snapshot of how my body had progressed, and then in certain areas, what did my gut look like now? What did that microbiome look like? What is 70% of the immune system's in the gut? So
absolutely,
we were able to retest, the gut. And then there's the new test, which was particularly interesting, which was oxidative stress. So I had never really looked, let's call it under the hood. And I had absolutely no glutathione. So my own powerhouse, antioxidant, my liver was just not producing any glutathione anymore. So we immediately went into IVs, right? Until we could fix my gut, we went in. I love the fact that I have a blood cancer, and Progressive has so many of the ozone IVs. Because of my oxidative stress, because of my background as a R&D engineer, I worked in the battery field for 5 years. I was probably exposed, at some point back in my engineering days. So I definitely do the high dose vitamin C. I love the alpha lipoic acid, because in my family, there's metabolic disorders, Alzheimer's and diabetes. So that helps regulate my blood sugar, which again, we're creating the terrain in my body that's not friendly to cancer.
Yeah, you mentioned something called oxidative stress, and that's a term that is getting a little more traction today in our society. And the reality is, oxidative stress is the gateway to chronic diseases. And I give this as an example. The body, as I mentioned earlier in a previous segment, 30 trillion cells. It's a lot of cells, right? We're just all these cells, and these cells communicate. Oxidative stress is caused by free radical damage. What is that? I want everybody to visualize an apple. Cut that apple in half and let that apple sit there on your table for 3 hours. Visualize what it looks like. It becomes brown. Why? Oxidation. Okay, that's what's happening to your cells. In other words, it could be browning, and even worse, rusting, right? Even though you're not rusting, I want, metaphorically speaking, the body is rusting. So what do? Well, if I put lemon juice on that apple, that's going to delay the process. And that's where there's a balance that God designed our body. It's called homeostasis. You should have some oxidation, because oxidation will destroy certain pathogens, but then there's a feedback mechanism for the body to make its own pathways of these super antioxidants, as Christen mentioned, something called glutathione, which is a triamino acid peptide, and that's 3 different amino acids that come together to make glutathione, okay? And also, there's something called superoxide dismutase and catalase. And the body has this mechanism. These are all protecting the cell. Yes, oxidation's bad, but you need a little, but too much destroys the cell. And with Christen's diagnosis, right, of chronic myeloid leukemia, her body was oxidizing. Her body did not have that feedback mechanism. She was tested, because if you don't test, you just guess. The testing empowered her to take action. If you just come in and I say to you, oh, Mrs. Jones, just have a healthy diet. Well, first of all, what's a healthy diet, right? That doesn't make any sense at all. What's a healthy diet? What's healthy for you? And that's why we do the testing. We know what foods cause inflammation. We look for oxidative stress. We look for something called leaky gut. It inspires you to take action. And that's why I like the testing so much. Okay, so now you had these IVs. What other therapies did you do at Progressive?
So, definitely. Any type of oxygenation, as we know from the Warburg effect. Dr. Agolli is such a great educator as well. The cancer does not thrive in oxygen-rich environments. So,
absolutely. Otto Warburg, 2 Nobel Prize winner. This guy was a genius, right? He gave us the tools to think, and now his research is being confirmed by numerous scientists.
So I'm hyperbaric oxygen chamber. We have the exercise with oxygen therapy, which of course I love as an athlete myself. My new favorite is the molecular hydrogen. I've been doing that every single morning. That's
fascinating. I encourage all of you out there that's listening. So 9.7 or 9.8% of your body is made of hydrogen. That's believe it or not, we're made of gas, right? That's crazy, right? A lot of people don't know that yet. You're made of gas. And hydrogen actually will reset the mitochondria, which is the spark plug of the cell. What we're learning right now, Christen, by some forward-thinking physicians, scientists, that cancer hijacks energy for fuel, hijacks glucose, hijacks the mitochondria, can hijack fatty acids, and we try to find different mechanisms to block those pathways. And our licensed practitioners at Progressive Medical have been trained, and now they're doing repurposed medications, which is another area we're going to talk about at another segment. Hey, if you're listening to Rethink My Health, we're so excited that you're here listening to us. This is our first show of many. We are actually going to be doing a whole year, and we're going to be interviewing some amazing scientists. One of the individuals we'll eventually be interviewing is Jordan Rubin. He just wrote a book called The Biblio Diet, and Dr. Axe as well is the co-author. Christen, we only have a couple minutes left, and I really thank you for coming on our first show. I'm excited you're part of a team at Progressive. Let's finish up with some words of wisdom. I want you to talk right now. There's somebody out there, whether it's a friend or family member, that just got diagnosed. What words of encouragement would you give them right now?
Get the support system around you. You're going to need it in every aspect. You know, as we talked about with holistic medicine, it's not just the physical, the diet, the therapies, it's the spiritual, it's the mental. The biggest piece of advice, there's going to be a lot of people that mean well. I had a lot of advice, and people told me to do good things, but some of those good things can feed cancer. So I would definitely say you can't play Russian roulette with this, right? There's actually so much information now, you know, there's almost too much information and not enough wisdom.
Great point. Information overload. I agree with you. So find someone you trust is the message I'm hearing.
Yes.
Take action. And sometimes you have to have a leap of faith, but you can control a lot of your environment. Chris, I want to thank you so much for joining us. Any of the last things you want to share before we sign off on Rethink My Health?
Definitely do it now. So be progressive. You're worth it. Pour into your health now, and no regrets for later.
Absolutely. That's Christen Perrella. She's a patient advocate at Progressive. If you want to meet her, you can come to Progressive Medical. Just go to www.progressivemedicalcenter.com, and we're treating all kinds of chronic diseases. We're thinking outside the box. As I mentioned earlier, there is no box. Rethink My Health is here to inspire you, to galvanize you to take action. If you never heard of integrative medicine, just to encapsulate, integrative medicine is just good medicine. It's a combination of traditional, holistic, natural, scientific therapies that actually help your body heal itself from the inside out. Be inspired. And I just want to leave you with a proverb, Proverbs 17:22. A cheerful heart is good medicine, but a crushed spirit dries the bones. Be cheerful. God bless you guys, and we're going to see you next week here on Rethink My Health.